And at this point of the show, I would like to bring in my special guest, which is Stephanie and also Allison from DirectLabs. Are you guys there?
Hey, Alex. How are you?
Hi, Alex.
Hey, how you doing, ladies? I'm assuming you heard part of the show.
We did.
Yes, and I guess it kind of sways into your DirectLabs here, because Dr. Walt, he kind of brings up a good point, and this is what you guys are about, that you need to have blood testing to see where you're at on the biochemical level, on the cellular level. And
right.
at this point, this is really what you guys are about. By the way, everyone, DirectLabs.com, or you can go to our website, NDCSavingsClub.com, and look at blood and lab work, and you'll be able to just click onto it, and you will have these great, knowledgeable ladies on the call like we have right now. Tell us a little bit about your company and how it is and how long you guys been around.
The DirectLabs have been around since around 1993 when it was first established.
Okay.
We provide direct access testing for those who want to take charge of their own health and personally monitor their own wellness. We provide the lab requisitions to the individual to get their labs done.
Mm-hmm.
We provide the results to them as well. Most tests come back between 24 and 48 hours. However, there are some tests that do require longer.
Mm-hmm.
The information that we have is on the website at DirectLabs.com, or we have the portal for the New York, New Jersey, and Rhode Island patients at DirectLabs.com/access.
And also, ladies, also on our NDC Savings Club radio show, we have that also on right there in the category. So people can go, that are listeners to our show, they can go right and click on lab work and blood work, so they can click onto and give you those portals as well, so they can go there. You just mentioned there that this is a nationwide program?
Yes, it is.
Okay, great. And I see that, like you said, 1993. I was doing the calculations here. It's like over 22 years. So you guys have been at this for a while.
Yes, we are the pioneers.
Wow, that's really great to hear. And ladies and gentlemen, as you hear on the show, definitely if you want to, you can email us in through the NDC Savings Club and put in your comments or questions you might have for the ladies. So again, everyone, we do ask for people to send in your emails, and you guys do. But I'll get back to maybe to some of the emails that are going to come in. But either Stephanie or Allison, with your program here, what kind of testing can you guys do?
We offer blood tests, hair, urine, fecal, and saliva.
Okay. And how would that work? Let's say I'm in Colorado, I'm in California, I'm here in New York. I want to know what my thyroid levels are, if it's within normal, or I don't feel right, and maybe I don't have any insurance, but I can, look at your program and say, you know what, that's pretty affordable. Let me see where I stand. So what do I do? To just call you guys up?
Yeah, you can call DirectLabs and place your order.
Okay.
With one of our representatives, or you can go to the website, like I said earlier, at DirectLabs.com.
Mm-hmm.
The process is simple. You register on the website, you choose what test you want, you prepay for your test, and we provide you with the lab requisition that you need to bring over to LabCorp to have your blood drawn. However, for the states of New York, New Jersey, and Rhode Island, the process is a little different because of the billing laws in those states.
Mm-hmm.
So there's a separate portal that you would need to go to place your order, and you would pay the lab directly for the test instead of prepaying like the other states. So it's pretty much the same concept, just in a different layout and a different website.
Okay. And saying all that, what would be the difference? And you mentioned their LabCorp. I know that's a major nationwide laboratory testing because I've been there. That's where I go to.
Absolutely.
And it's one of the major ones. So and most people probably on the phone, if you need, you probably have gone to LabCorp. So let's say I don't have any insurance and I need blood work, whatever, and then I'm not sure. I walk into LabCorp and I have whatever tests I might need that, or the doctor might recommend, and I go to LabCorp. I mean, there's a certain price that I would pay. Now, if I do it through you guys, would it be a little bit cheaper? Would it be a savings to me?
Most probably, yes. However, there are some tests that you may get at a cheaper price if you go directly to LabCorp with your doctor's order, because you have to have a doctor's script to get your labs done.
Okay.
If you don't, then you cannot go directly to LabCorp to get that done.
Okay.
So on most tests, we can pretty much beat the price on that. But like I said, there are, I'm sure, tests out there that they can beat us on. So everything is volume driven. So the pricing can vary.
But me coming off the street and don't have any insurance, whatever, if I go directly to LabCorp, I mean, what kind of savings can I expect? A 5%, 10%, 30% savings? What savings would you be able to provide?
The savings that we offer is up to 80% off of retail.
Okay, and isn't that what LabCorp charges, retail?
That is what LabCorp can charge individuals and for insurance companies. So that's going to vary.
So, I mean, if I get a 30%, 50%, maybe, a 70% saving, that's considerable for me and my family.
Absolutely.
And if I need it. Wow, that's a pretty nice deal. So then this way, and also, too, what's been happening with medications, with insurance and stuff, a lot of times certain procedures or tests might not be covered by your insurance, where this is where if it's not, you might want to give you guys a shot to see if you'd be able to save you some money, correct?
That's correct.
And I'm assuming that's happening. You guys have been doing this for a long time, but have you been noticing that this has been happening more and more now, lately?
Yes, most definitely.
Yes, and that's just the way it is. I mean, higher co-pays, medications not being covered, tests are not being covered. So then this is a great value for the audience here, that if they need testing for blood work or labs, they'll be able to have access to this. What are some of like your popular tests that people would take for their health?
We have a comprehensive wellness profile that we designed with LabCorp, with a team of doctors there, and it's our number one sold test. It involves over 50 results that you'll get, including thyroid, cholesterol, CBC, minerals, bones, electrolytes, liver, kidney. The retail price on that is $542. We sell it to the general public for $97.
Wait, you're saying $542, that's the retail price from LabCorp, and you guys sell it for how much?
$97.
Wow, that's...
And, of course, New York, New Jersey, Rhode Island, those states are different, and we sell it there for $125.
Wow, but that's still a great savings. I mean,
absolutely.
I'm curious about that test. Would that test? I don't know. I feel sick. I feel something is wrong with me, and I know something is wrong. So then I might want to go to you guys, get this overall test. What do you call it?
The Comprehensive Wellness Profile.
Comprehensive Wellness Profile. And through that, I pay either the $97, which is a huge savings from $550, let's say, and $125 in New York, New Jersey, and Rhode Island. I mean, that's still a huge savings. And I'm just curious. I mean, besides giving me all my cholesterol and thyroid and everything that might be wrong, like you said, over 50 different factors or factors that you guys are testing, would it also show me, like, maybe if I have cancer?
This test is not going to indicate if you do have cancer. However, we do offer tests that can be an indication of that.
Okay.
That's aside from the comprehensive wellness profile. But the comprehensive wellness profile that we do offer it can be used as a baseline for, if you are not feeling well and you want to just have a general outlook of what's going on, you can provide the results that you get from the comprehensive wellness profile to your physician, and they can go from there and say, okay, well, let's have a look at your thyroid. So it is a baseline test.
Okay.
For overall wellness.
And I'm assuming that it will give you the testing and it will give you the normal parameters, and it will show if you're under or over your parameters.
The results that we provide to the individual will have a reference interval, and it will indicate if your number is high or low, or if there is a critical. If your results are way high or way low, then the LabCorp does indicate, hey, you need to get a hold of your physician, or they can give us an alert on that. So you are notified if your results come back with any kind of abnormal ranges.
And you guys would notify the patient?
Absolutely.
Really? So you...
Yeah, and then if they would like us to send their results to their healthcare provider, we can do so as well.
Oh, so you can by email or by fax, whatever they would need.
Right.
If you're a primary doctor.
That's correct.
And then.
If it's critical and they want the results sent, then we do that.
So then. This is a great way of beating things before maybe, being proactive to take care of your health before you wait and wait and wait. It's like I'm looking at it as many different ways as saying that, if you're at a traffic light, if you decide to make a right but you make a left, you might get hit by a car, so you avoid it, or... And like in a dental situation, that if you have a toothache, and you wait and you wait and you wait, and the toothache gets worse and worse, and then your whole jaw gets infected, and then half of your bottom teeth are going to have to come out because your whole jaw is infected. So if you're able to do preventatively, and we all know our bodies, and we know something's wrong with it, here's a great way that you can have this testing done. And I'm assuming that you can... I see that's a toll-free, 1-800 number, and then a prospective patient can call you guys up and can talk to, and you guys can suggest different tests that the person can take, correct?
We do not recommend tests.
Okay.
But we can order the test that they will need. Like if they say, hey, I want to get a cholesterol test or a thyroid test, we would need to ask them, okay, which test do you want? And we can tell them what test we offer. And then they can, get with their healthcare provider and see which one they need. But as far as us recommending, we're not allowed to do that.
Correct. So you have to have a doctor to recommend. Do you guys have doctors on staff that people might speak with?
We do have a nutritionist that does handle or that does offer consults. His consultations are at a fee.
Yes, correct.
It's a very minimal fee, but I mean he can advise you what tests that you could do. And his name is Dr. Barry Bennett.
Okay. Great. So then the best way is that you can be proactive, look at your website, and you can judge it for yourself that what tests you might think that you might need, then order the test, and then go to a convenient location, LabCorp, because I know there's tens of thousands or whatever, hundreds of thousands or whatever, thousands of LabCorp locations throughout the country. How many are there?
I think there's 3,000 plus.
3,000 locations. So any major city would definitely. I mean, let's just say realistically, you're within a 5-mile to a 50-mile radius of getting to one throughout the country. You know?
Normally, yes, that is correct.
In the major cities.
Yes.
Yes. We're I know you have to drive a lot more, and people are used to it. They drive hundreds of miles to get to Walmart. You know, that's kind of normal. But within the major cities, yeah, you're probably 5 minutes or 15 minutes or half an hour to an hour within the LabCorp. So you can go there and take the testing. I mean, I've gone to LabCorp. It's really very convenient, and they do give you the testing very quickly. And through the services, you guys will be able to provide that now to the member. And
absolutely.
I mean, it sounds like a really, really nice deal.
And what's so great about DirectLabs, Alex, is that it really, it offers the ability to the individual to take their health into their own hands if they're concerned about certain issues themselves without having to go to the doctor. They can come through us and get tested for what they think, is wrong with them.
And nowadays, correct, and nowadays having this great station like PRN, the NDC Savings Club, which is their health-driven, to take charge of your health, and that's the whole concept of the Savings Club, so people can have access to all this information, then you can narrow it down better instead of going to a whole bunch of doctors and spending a ton of money, where you can narrow it down to yourself and then talk to your doctor that, look, looks like what I need, and being proactive, so then they can notify their doctors and they can submit the test, and then this way you'll be able to have a good footing of where you're at on the biochemical level.
Right.
No, I like the concept of your company, that you guys are proactive in reference to the testing. So people can.
We appreciate that.
Yeah, I mean that's different. That you're focusing on that aspect, so people can go and take care of themselves first, and hopefully, the results come back good or bad. At least you can take care of it before.
And you will know, right.
Before things get worse. So, I'm getting some emails here. I have here Ken from Colorado. And he asked that the cholesterol thyroid test, how much money, would he be able to save on these type of tests? He's asking here. I guess if he goes compared to retail.
On the cholesterol test?
Yeah, and he says he had here cholesterol and thyroid.
The prices on that will vary. Say, for instance, on a lipid profile. It usually runs about, was actually on sale this month for $19.
Oh, wow.
Retail. I'm sorry?
No, that's great.
Yeah, and the retail on the lipid profile is $98.
Mm-hmm. So that's a nice savings.
Right,
and that's going to give you the full lipid profile as far as the cholesterol, triglycerides, the good and the bad, and LDL, HDL.
Oh wow!
And the thyroid panel, and that would depend on what test he would need. We have several thyroid panels. Just the basic runs about $45.
Mm-hmm.
And the retail on that is $182.
Wow. I mean, all these tests are beyond 50% savings.
Yeah, significant savings.
Right.
70 to 80% savings. So, I mean, it's up there. I mean, that's the whole concept of our savings club, to help people save money. If you don't have any insurance, or insurance not being covered, or sometimes this might come out cheaper than your regular insurance, and that's a way that people can save money. So, no, those are a really great prices. I have another email here from Juan from New York City. He says that it says your account. Do I have to open up an account with DirectLabs? He was looking at your website.
If he wants to order tests, then he would have to register on the Access portal. So, yeah, he will need to create an account in which that will allow him to order the test that he needs.
Okay. So there is a safe account that people can go in to log in. You have your password and all. It's protected.
Absolutely. So everything on the website is secure.
Secure. And then people can just go there and I'm assuming that same information, the account could be sent over to your doctors and all, to the people's doctors.
Right. They can submit a HIPAA form in their account. If they want their results to be sent to their healthcare provider, then we can do so for them.
Oh, that's great. So you guys are also up to speed in reference to the technology. Just a quick question. I'm curious. Do you guys have an app for this as well? Or you?
Oh, what? I'm sorry?
You guys have like an app? Like now
yes, a mobile app?
Yeah.
Absolutely.
Huh? Oh, wow. Okay.
I can provide that to you.
Yeah, that'd be great. Maybe that could be also something else that we can add to your profile on the NDC Savings Club. So
and Alex, it's not actually a mobile app.
Okay.
It's an optimized site for mobile devices.
Okay.
So it's like a miniature version of the main website.
Okay.
It doesn't require any type of download. I can just give you the website, and you can go to it from your mobile phone.
Okay. Yeah. We'll put that up on our NDC Savings Club, and then people, if they want to, they can go to that site there. Okay.
Okay.
I mean that's really great. I have here another question from Keith from North Carolina. He says, how can I find the labs in my state, in North Carolina?
On the website, DirectLabs.com, you'll click on lab. You can click on the lab locator.
Okay.
And enter the zip code of your area, and it will provide you with a list of labs that are closer to that zip code.
Okay, so that they would show you.
Absolutely.
Okay. All right. I mean, this sounds really, really good. We're up to probably the next minute or so. Our show will be up. And I wanted to say here that you guys are giving our members for the NDC Savings Club a special savings also, a 10% savings if they have a special code.
Right, and the code is
NDC.
Yes, R-NDC.
Uh-huh.
And if they call in their order, they can provide that code to the representative, and they'll get their discounted price.
Okay.
Or they can visit the personalized portal at DirectLabs.com.
Uh-huh. So
/NDC Savings Club.
Okay, great. So our members, on top of your already lower discount, and that's what we arranged with you guys with DirectLabs, that they're already getting a great savings. Like I said, they're getting 70% off. If they say this code, which is R's and Robert -NDC, they'll get an initial 10% off.
Right, it's up to 10%.
Up to 10%. Okay, every saving.
Now that does not include New York, New Jersey, and Rhode Island.
Yes.
Because the process is different. Okay.
Yes. Well, ladies, I really appreciate your time. We're up to our time here. I hope to have you on a future show, but I really appreciate and thank you for your time.
Thank you so much for having us, Alex.
All right. Thank you, ladies. Talk to you guys soon. Bye-bye. Okay, everyone, as you hear, that was the NDC Savings Club. We're up to our time. It always goes by so fast. Please go to the NDC Savings Club. Don't forget to rate us on iTunes, like us on Facebook, and we're there. Tell your friends and neighbors about our great program. Thank you.
Okay, goes to 45. World's changed so bad. 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 World's changed.